You do make a great point of how there are a lot more people working from home now, and business has definitely changed, but we are all really adapting, making it work for us with the technology that we do have. So that is great. So how has HUI done during this time? Do we have any advantages or disadvantages going for us that have really helped us pull through this kind of tough time that we have going on?
We've got two major markets that HUI serves. So there's the medical market as well as the industrial market. So, years ago when HUI decided to enter into the medical market, probably about 20 years ago, for us that was a strategic decision because we didn't want to have all of our eggs in the industrial basket. And so we started that journey 20 years ago. And in situations like we're in right now, whether it's a recession or now like this pandemic situation, we see the benefits of being able to be in two distinctly different markets. Even though that the services that we provide, sheet metal fabrication, powder coat painting, mechanical and electrical assembly, work in both market segments, right? We can provide those resources in both market segments. It does allow us to be able to level out those ebbs and flows, or when industrial is down and medical is very busy, or vice versa. It allows for our business to sustain and get through those slow periods.
Yeah, and just to kind of tag on to what Nick said there too, is that we're kind of fortunate in the sense that we're diversified in both business segments. So not only in the industrial side, but also in the medical side. So like I had mentioned before, where some of our medical customers are in the elective procedure markets and others are very busy right now with the whole pandemic situation. The same could be said on the industrial side of our business, where some of our industrial customers have slowed pretty significantly, whereas others have maintained a certain level of normalcy from their order pace. So having that diversification in both industrial and the medical markets has been beneficial for us to, really stay afloat.
Back several months ago when this pandemic started, a lot of companies were blindsided because they didn't know how this was going to affect them, how it was going to affect their business, how it was going to affect their employees, or even if their company was even going to be running or having to shut down. So a lot of companies were really hit and stalled a little bit when this all happened. So as experts in the industry, what advice could you give companies that they can maybe better prepare for this if something like this does happen again in the future?
So as far as I'm going to speak specifically to introducing devices or technology into the market. So, one of the things that I've bumped up against, especially with looking at new projects with companies, is as they're wanting to launch something very quickly. There's a couple of factors you need to take into consideration, right? And especially if they're not familiar with the medical device standards, right? For example, 60601. We had a client contact us recently where they wanted to introduce a ventilator device, right? And they had a great design. They're really getting close to the finish line with a ventilator. They decided they wanted to slap it on a cart. And then one of the things that they didn't take into consideration is the fact that you still need to do 60601 testing. And the cart needs to be 60601 compliant. And even though that you buy a cart, you can buy a cart out of a catalog, you can buy a cart from a cart manufacturer like HUI, you still need to put that device on that cart, and that whole system needs to be considered 60601 compliant. And those are some of the things that are being forgotten about or being overlooked, or are going to prevent them from kicking it over into the marketplace if they don't take those types of things into consideration.
Yeah, another thing I would add to that is supply chain capability as well. So a product could be brought to the market, and there might be a limited amount of one component that would be readily available for that product. But if there's not enough product in the pipeline to support that under high production demand, in like the case that you had mentioned with the ventilator build, there's walls that companies are going to run into when it comes to those supply chain issues. That's where we're kind of fortunate too, in the sense that on some of our larger running stuff, we do have inventory agreements in place, both with our customers as well as our suppliers, to have a certain level of inventory held both at HUI and within our suppliers' facilities, so that way we can take and maintain a steady stream of product to our customers without running into a shortage.
I'd like to thank Nick and Chuck for getting on this call with me today and discussing some of the insights that they have on the industry and what's going on right now. If you do have any questions for either Nick or Chuck, you can leave us a comment below this video and we'll get back to you as soon as we can. Otherwise, I will provide both of their contact information at the end of this video, and you guys can reach out to them directly as well. So thank you for watching today and stay safe.
Yep. Thank you.
Thank you. See ya.